My name is Danielle Henderson, and today I will be here to inform you about sickle cell because I am a patient with sickle cell. What is sickle cell? Sickle cell is a blood disorder that affects the red blood cells. As you can see here, this is the normal red blood cells. People without sickle cell, their cell is shaped like a donut. Then over here are the people who do have sickle cell. It's a crescent moon shape because their cell starts to sickle and it's no longer a donut shape. The signs of sickle cell. The signs of sickle cell are repeated infection, chronic pain, and low red blood cells. The severity of sickle cell. The severity of sickle cell, you may have some people with mild cases who never have pain. Then on the other hand, you may have somebody who is always in severe pain and frequently hospitalized. The fatal effects of sickle cell is strokes, death, and organ failure. How is sickle cell inherited? Sickle cell is inherited by the parents who have the trait. As you can see right here, this shows the two parents who have the trait. Then it shows their offsprings. A person who doesn't have the trait or the disease, the person who has the trait, and the person who's born with the disease. There's a 50% chance that your child will be born without the trait or the disease. Then there's a 25% chance that your child will be born with the trait. Then there's another 25% chance that your child will be born with disease, which is in my case, I was born with the disease. Sickle cell is the most common inherited blood disorder in the United States. This disease is estimated to occur in 1 in 500 African Americans and 1 in 1,000 Hispanic Americans. How common is sickle cell? Sickle cell affects people worldwide, but it affects those whose ancestors are among Africa, Central America, South America, and some parts of the Caribbean. Treating sickle cell. There are many ways to treat sickle cell, like staying hydrated, water, Gatorade, going to the hospital getting blood transfusions, and also taking pain medication. This is my pain medication. Another thing is you can take your regular medicine. This is a medicine called hydroxyurea. It creates new red blood cells, and the new red blood cells, it gives your body oxygen, and this decreases the pain episodes you have. The cure for sickle cell. The cure for sickle cell is going to get the blood and bone marrow stem cell transplant. The donor has to be closely matched in a close family relative, family member. And they can't have the sickle cell trait or the disease. How can sickle cell be prevented? Well, sickle cell can't be prevented because it's inherited. But for those who are looking to have kids or whose kids are at risk of having sickle cell, you can go to a genetic counselor, and the counselor will explain to you the possibilities of your child being born with sickle cell. And they also can explain to you and help you with other things that are available. Different types of sickle cell. There are 3 different types of sickle cell. The first one is hemoglobin SS, which is the more severe case of sickle cell, which is what I have. Then you have hemoglobin SC, which is they have similar symptoms as SS, but it's more milder and not as serious. Then you have beta thalassemia, which is lack of oxygen in some parts of the body, weakness, fatigue, and pale skin. Again, my name is Danielle Henderson, and I would like to thank those for letting me inform them about my disease, sickle cell. Thank you. These are my audience. my brother, Dijon, and my mother, Felicia. Thank you.